The mic.
Sorry, I guess we can start.
Perfect. Thank you.
Great. So, hi everyone. Hello. Good evening, good afternoon, and good morning, depending on which part of the world you are in. And a warm welcome from Women for Global Fund and IPPF South Asia Regional Office. My name is Sylvester, also Sylvie. I am Regional Community Engagement and Networks Lead with IPPF South Asia Regional Office, and I will be moderating this important discussion highlighting the urgent need for gender transformative responses that addresses the unique challenges faced by women who use drugs in Asia Pacific region. We have a fantastic line of speakers today who will share insights. Uh, just a minute. Insights, evidence, and lived experiences to guide our advocacy. Before we begin, let's take a moment to acknowledge the significance of this conversation, which is actually dedicated to International Women's Day. While International Women's Day brings global attention to gender equality, we recognize that these conversations must be continued beyond a single day. That's why we are gathering this month to focus on a critical yet often overlooked issue, which is ensuring gender responsive harm reduction and health services for women who use drugs. Before we dive in, a quick housekeeping points. Please keep your microphone muted unless speaking. Feel free to use the chat box to share questions and comments. And this session is also being recorded and will be shared afterwards for those who may not be able to join us live. And once again, this is an internal exercise. So we will take the consent if we quote you from this conversation. Now, without further ado, let's begin to set the stage. And I'd like to invite Tomoko Fukuda to share some opening remarks. Before that, let me also introduce her. Ms. Tomoko is the interim regional director of International Planned Parenthood Federation in South Asia region and the regional director of East and Southeast Asia and Oceania region, IPPF. She leads the IPPF Secretariat for SARO countries for advancing sexual reproductive health and rights. She is also a member of IPPF Global Senior Leadership Team, headed by the Director General, holding responsibility for strategic leadership of the IPPF Secretariat across the globe. Prior to joining IPPF, she was an advocate for global health, particularly for SRHR through roles such as General Secretary of the Japan CSO Network on Global Health, local coordinator for the G20 Gender Working Group Steering Committee member of the Asia Pacific Alliance on SRHR, and as an advisory group member of the Civil Society Engagement Mechanism for the Universal Health Coverage. So, yeah, over to you, Tomoko. Thank you.
Thank you. Thank you so much, Sylvie. And it feels a little bit ticklish to be introduced so extensively, but thank you so much for that introduction. And a warm welcome to all of you who have cut out time from your busy days to join us today. A special thanks to the Women for Global Fund who have collaborated with us for this really special event. We have so many reasons to come together at this time. And Sylvie mentioned International Women's Day. Yes, it is a time where we get to voice our needs and our challenges. It is also a month we celebrate gender equality and the push for that. We also know that this year is the Global Fund's eighth replenishment. It is a very crucial year for us in that sense. And we also know that we are only 5 years away from what we agreed as the SDGs goal. And we are far, far, far away from achieving what the country set out. And in this month's World Bank's blog, they mentioned that it will take 134 years for us to achieve gender parity. That's how far away we are from achieving anything around gender equality. And then we all know what happened this year in January with the Trump administration coming in the anti-gender, anti-rights movement seems to be getting bigger and bigger as the days go by. It is sand with wind. It is gaining momentum. And we are here to come together, to fight back, to push back. And that is why it is so critical for us to come together at this time. So I really thank Women for Global Fund and all the speakers who have agreed to come together to share their knowledge, to share their experience as we face the challenges that we are seeing now. And we know that gender equality impacts women's health across sexual reproductive health and rights, HIV, TB, malaria, in all aspects. And we know that we cannot just be grouped in one, as in women and girls. We know that we have all the different layers of intersectionalities. We have diverse ways of living that impacts us differently. And today we are spotlighting on women using drugs, just because we really need, this is what we need to do. We need to break down who we are, not just women and girls as a whole, who we are. And the deeper we dive into the needs of every diversity that we live in, the more tailored we can become in our responses, the more applicable, relatable our responses will become. And we need to do that. In IPPF, we have agreed to stand up for, and this has been our value since the beginning of IPPF, that we stand for the rights and the well-being of the most marginalized and excluded in our societies. And we want to spend the next hour and a half together with you to discuss, to share, to learn from each other. Yes, we would like to raise our voices together towards governments. As the H replenishment comes around, we do want to ensure we push our governments, and maybe not just the traditional governments, maybe new governments. We might want to reach out to our countries in the South. We all need to step up to achieve the SDGs. I think we all now know that we cannot just rely on certain countries to do and to replenish and to respond to the needs. And we need a collaborated effort across CSOs, private sector, governments to work together on this. So this 1.5 hours is a reflection of us coming together, and I'm super excited to hear from our speakers today. We have a great lineup for you. So without further ado, I hand back over to Sylvie. Thank you.
Thank you, Tomoko. We indeed stand in solidarity for all the intersections. And thank you for your opening remarks, Tomoko. Moving ahead, please join me in welcoming Parina, a dedicated activist and professional with over 20 years of experience advocating for women who use drugs, PLHIV survivors of domestic violence, single mothers, and sex workers in Nepal. Her work focuses on gender-specific issues, stigma reduction, SRHR, domestic violence, and the intersection of drug use and HIV within the feminist movement. Welcome, Parina. So my first question to you, Parina, is can you just share how women who use drugs can advocate and influence the development of health policies, gender transformative investments, and strengthening health and community systems? What are your thoughts on that? Over to you.
Thank you all. Thank you, IPPF, and everybody who are listening to me. First of all, Happy Women's Year. Every year should be Happy Women's Year, not just a day. I'm Parina. I'm representing Pushti Nepal, and I'll be talking about women who use drugs. And thank you, everybody who has given this platform for us. As Tomoko shared her experience on how women are left behind, and women who use drugs are far, 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 far left behind. So this is my pleasure to also share that we have partnered with FPAN, Family Planning Association Nepal, for inclusive SRHR services. However, that was not always the case. If I have to look back and talk about 20 years, it's been 20 years. This year is 20 years of the existence of Drishti Nepal. It was very difficult and no engagement, no visibility, no women who use drugs. Where were we? We were like somewhere, I don't know. And unfortunately, if you look at now, it's not as much as that, but still the level of stigma, the level of how people look at us is almost the same, unfortunately. And also, like our experience being one of the first by and for women-led drug users, women who use drugs led organization in Nepal, we have partnered with NCAC, the national body for AIDS and STI control, UNODC, USAID, AHF Nepal, IPPF, Save the Children Global Fund, ITPC, WFA recently. But, it took us long way to come till here, where we had to advocate for, there wasn't any data, no single data. It only started after the existence of Drishti Nepal. And of course, indeed, like there were other organizations who supported us. Having said that, yes, we could influence all of the what we say donors or partners, or the supporting NGOs or civil society. However, we need more of gender transformative investment so that we understand where we stand and what we can do further, And the recent experience or the recent scenario, if you look at the whole the Asia thing, there are very less advocates, there are very less investments, and there are very less voices where we get platform, where we can go and talk about our issues. So from my perspective, not only the gender transformative investment, but also the technical support, the flexible funding. That is one of the major things, the flexible funding. Please, I want to, push forward about flexible funding, because our women's group are from diverse community, from diverse background. Like Sylvie, he said, it's when we say women, the picture of women, when people see or think of women, they only see certain features. It's not all about that. We have lots of intersectional group in between, and we're trying to continue enhancing their voice, and we need investment so that our advocacy and our movement can move forward further. So I would just say the investment not only from the perspective of HIV, but also from different lenses of health and human rights. Thank you.
Thank you, Parina. Which actually also, in a way, kind of links to this other conversation, basically, which is around, what do you think are the most critical needs and, importantly, health challenges of women who use drugs in your area of work or whatever experience you have. If you can just kind of, highlight us about that as well.
I would like to, there are lots of critical needs and there are lots of challenges. But the most important thing recently, no, I would not say recently, it's been 4 or 5 years that we have realized that how our women's group, women who use drugs, we're only confined within the HIV box or the HIV lenses, not from sexual and reproductive health rights, not from health and human rights, not from, poverty lenses, not from food, not from SDG lenses, you know. So that is one of the major and critical, I would say, challenge, and also the need that now it's high time that women who use drugs should be there from every point, you know, from policy making, from planning, from deciding what we want. And other than that, of course, like in only 2024, that was the first time that Dristy Nepal, we initiated in collaboration with, of course, AFPAN and UNODC. For the first time, we started sexual and reproductive health rights training. Imagine within like 17, 18 years of time, we didn't look at that. And I would say it's not our fault. It's actually where whenever there is any sort of let's say national planning or international planning, we are nowhere, we are not there. So that is one of the things from program perspective. And of course, very less harm reduction programs where still, I would like to say, where still women-led programs are under the, let's say the pay gaps, very less money. We have to work in less money, whereas we are talking about, pay gaps globally, and then we, as a community member, we're working in less than $100. This is injustice that we are going through, in each and every programs. And there's like, the opportunity, very less opportunities. And because of all these things, our women, they are not able to access to the services because there's no enough funding. And not only that, if we, like our experience working with women for, every year we reach about 300 to 500 women who use drugs in the field. And out of that, most of them are going through domestic violence, sexual violence, clients violence, who are into sex work, they're going through clients violence. And then the whole harsh policies or the policies which are the system which are not addressing our needs or what we are going through, it's creating more of challenges for us to access to the services that are available here in Nepal. And I'm sure like it's not only in Nepal, it's all over Asia, because of course, like there are different, different background or the cultural aspects. But however, we being women from drug using background or single mother, it's nowhere out that we could actually access freely or decide about our bodily anatomy for ourselves, And now, at the current situation, Nepal government is trying to work on the age of marriage, 18 or 20, If we look at the whole data, even in women who use drugs, most of the women are young mothers and they are single mothers. So these are the only few challenges I would like to share here. And yes, I am fortunate enough to talk in English, but there are lots of other peers who cannot talk in English, who cannot come to us. So there is a huge gap on, even from the donor agency. They would only look at us from HIV perspective. Now it's time to break that silence or the movement, and then we have to get into all the movement where we can, not only with HIV, but also sexual and reproductive health, feminist movement, poverty, SDG, young person living with HIV, women living with HIV. So yeah, those are the critical areas and needs that we want to address.
Thank you.
Thank you so much.
Padina. Thank you for those insights, especially from the lived experiences. Moving forward to our next speaker, who is Dr. Suchitra Dalve. Dr. Suchitra Dalve is the coordinator of Asia Safe Abortion Partnership, which is a regional network for safe abortion rights and has members and partners in over 25 countries across Asia. Through ASAP, she guides the advocacy and capacity building work with member countries across Asia and at global forums. She is a gynecologist and has been involved in development work for over 25 years. Dr. Dalvi is also the founder and lead trainer of the ASAP Academy, which is the first global online learning space for abortion rights. Welcome, Dr. Suchitra. And I would say my first question or the point of conversation is that why we need to talk about reproductive coercion, abortion, sexual health, and rights now more than ever.
Yeah. Thank you so much, Sylvie, and thank you everyone for inviting me to be here at this very critical conversation. I think, as Parina said, if we are to remember the old slogan of leave no one behind, then I think the women drug users have really been left behind in so many of our conversations. And at ASAP, we are trying to work very hard to build inclusive movements. So I think for us also, this is a really, really important space. I think anyone who's been reading the news will know why it is so important for us, particularly now, to step up and speak out about this issue. Because, a conversation I had some weeks ago with someone who was talking about we need to eliminate gender discrimination. And I thought, you know what, maybe we need to eliminate gender. That might actually be the solution. Because if people can just be identified as humans, would that not resolve a lot of the oppression that is then forced upon people who are not at the top of the pyramid of the cis heteropatriarchy? And I think in that context, the whole conversation around the sexual and reproductive labor, usually the free and the coercive sexual and reproductive labor that's expected from all others in that pyramid, is something that would, very utopianly, hopefully also dissolve and be easier to negotiate. But I think in the current context, we need to also remember that human rights are not really possible to fully fulfill if you do not fulfill also the sexual and reproductive rights, because the rights to autonomy, the right to health, the right to life, the right to choose your partner, the right to decide whether or not you want to have children and then how many you want to have. I think a whole gamut of these conversations are very, very critical and very central to human rights as well as to SDGs conversations. And I think in the coming years with climate change, the increasingly, what shall we say, demographically leaning population policies that we are seeing, and we're going to be seeing even more, we need to really acknowledge what is the role that is expected of people who have a uterus and people whose sexual and reproductive labor is expected for various reasons. You've got somebody who's saying, he who shall not be named, who says we are underpopulated currently, whereas on the other hand, you've got people who are still struggling with unequal distribution of resources to their population. So I think in this context, this topic is really, really critical and very central. Unfortunately, is not recognized as such. So, we are living in a post-colonial, uber capitalist kind of a space where people are being seen only as labor or only as the production contribution. So anyone who's vulnerable, either as a result of being differently abled or IV drug users, or in any way not seen as somebody who's economically productive, is going to find themselves almost invisible in the general policy as well as programmatic paradigms. So that's why I think it's super critical for us to have this conversation.
Thank you, Dr. Suchitra. Actually, couldn't agree with you much on this, which leads to my second question, which is that we know we need to strengthen the intersectional feminist agenda, and ASAP is pushing for it. Can you also share your perspective in terms of the work which ASAP does and the overall body of work, basically?
Sure.
Thank you.
Sure. Thank you so much for the opportunity to share that. So the Asia Safe Abortion Partnership is a safe abortion rights advocacy network, and we have recently launched our online academy, which is very unique because it talks much beyond the technical aspects of safe abortion or even contraception, and we talk very much about the feminist inclusive politics of why safe abortion rights are so critical to any other social justice movement. So whether you're talking about, say, for example, preventing child marriages, or even women IV drug users, or people who are surviving domestic and sexual violence, in every topic that you can find, unwanted pregnancies are very critical to the conversation. And the way to manage these unwanted pregnancies through safe abortion, the kind of pathways that people have to undergo. And I find it very problematic when people say, oh, so and so women chose to have an unsafe abortion. Nobody chooses to have an unsafe abortion. They are forced into it because they're not being given the safe abortions by the people who should be held accountable, which is usually the public service provisions and the governments and the state. So this is the kind of work we do where we speak up and we speak out and we encourage partners across the range of geographies as well as issues. So, we recently came up with sign language videos because we worked with the deaf and hard of hearing community and realized that it was very difficult for us to engage with them because in the sign language there is no vocabulary. For example, like for patriarchy or even feminism, because unfortunately, people who are differently abled have been struggling for, just basic existence, education, etc. So the idea of, now negotiating for your sexual and reproductive rights it still seems like almost unattainable, like an extra, kind of very extravagant kind of a demand. So I think it's important for those of us who have the capacity and the vision to collaborate and bring together as many people as we can, because at the end of the day, it's just one planet. All the issues are universal, no matter what. Some countries may be going through different stages of their evolution right now, or devolution, or whatever is happening. But eventually, the politics is universal. And I think
True.
we need to embrace that universality. So this is again, we find that being from, the so-called global south, or being in our part of the world, um, I think it's important for us to step up as global leaders. We are not just leading the global south, we need to be leading the globe in these conversations because we have very rich experience. We have had centuries of struggle, and I think we have a lot to offer. So I think that's kind of the perspective with which ASAP is building its network and inclusivity. And yeah, thank you for the space to share this.
Thank you, Dr. Suchitra, for sharing your insights on this. And may I now introduce our audience to the next speaker, which is Dr. Anandita Dasgupta, who is an assistant professor of socio-medical sciences at Columbia University at Mailman School of Public Health. Dr. Dasgupta, in partnership with community partners, conducts interviews and implementation science research designed to reduce gender inequalities of health as they intersect with sexual and reproductive health among birthing people in South Asia, the Middle East, and the United States. She has had the privilege of focusing on ways to improve the lives of women who use drugs over the last few years, both in New York and abroad. A warm welcome to you, Dr. Dasgupta. And to start with, uh, you know, we would like to know your thoughts on we need evidence-based programs approaches, and how do we close the gap between academia and grassroots? How do we connect these two worlds?
Absolutely. And I want to add my gratitude and thanks to everybody, all the organizers, the organizations. I feel so lucky to be part of this. And then also, looking in the chat, the rigorous, robust discussion happening and seeing the organizations you all are from. I really I'm grateful for the opportunity. So, Sylvie, thank you so much for the question. This is a passion of mine as a lifelong typical academic at a university in the United States. So I love being an academic because I love my research methods and I love my fancy models, but none of that is any good if it doesn't actually help people. I think in research, especially in academic research, one of the biggest issues is that we often conduct research to simply understand a problem rather than understanding a problem for the sake of actually intervening, improving policy, informing existing programs. And so I'm very quick to always point out that I don't always get it right. My colleagues don't always get it right. But our goal in academia should really be in partnership. In my bio, you heard the word collaboration, partner many times, and it's by design. from the beginning, when we are thinking about research projects as academics, it's so vitally important that we are talking to partners, not just at community organizations, but those with actual living experience on a regular basis. I'm so lucky to be in that sort of collaboration also with Harjot and Sylvie and others at IPPF Saro, where we have ongoing conversations on a monthly or whatever our schedules allow basis, so we can come up with ideas as they're hearing from all of the great organizations and work that you all are doing, right? And that's just an example of sort of making sure from the inception of a research project, of an analysis, of anything, that academics are really working directly with those who understand the best what's going on. I just want to add also one more thing. I study a lot around gender-based violence. I also do all this work around HIV, substance use, and then also what often feels so separate is sexual and reproductive health and rights. And these shouldn't be separate, right? As the speakers before me have pointed out. And one of the things that I think is so vitally important as we are talking about evidence-based practices is finding practices that really hit at those intersections, using syndemic approaches, for example, where we are talking about how if we can positively impact one issue around violence, we can also positively impact other issues around isolation, healthcare utilization, and the like, as well as substance use. And I think those intersecting concepts are really important. And then finally, the other point in terms of sort of thinking about engaging with community partners and closing that gap. A lot of it when we're thinking about funding mechanisms, so much of academic work, especially, and I think programmatic work, has been so focused on HIV, as the speakers have mentioned before. Absolutely, that is vitally important. And I don't want to be misunderstood or misspeak. HIV absolutely should and still be a major focus in terms of prevention and treatment for people who use drugs, women who use drugs. However, I think when the funding streams are so narrow, as Parina mentioned, we don't get the opportunity to always think about those other intersecting issues. And so I want to echo Parina's call and wish for flexible funding streams, because I do think, I've been, I don't know if lucky is the right word right now, but I've been funded by the US government's National Institutes of Health a few times. And I will say that the more effective work that I have been able to do is by foundations and more flexible funding streams. And then the last answer, typical academic over here, long-winded and all, whether we're talking about birthing people, women, people who identify as women who use drugs, or people who are dealing with violence, we often say in the field of violence prevention and response, women know how to keep themselves safest. We also talk about that in harm reduction for women who use drugs. And so I think from an academic perspective, I can come up with a fancy analysis. I can come up with, the best, most rigorous evidence-based approach for intervention, adaptation, development, and evaluation, implementation science, all of that. But I am not the person who is living these experiences in a very privileged way from my perspective. So my job is to talk to those and value those voices who have been most impacted directly, and also reflecting that in leadership on our teams as well.
Thank you. Which actually directly in a way, we did talk about collaborations and working closely with the communities and research in a broader way. But then if I kind of try to narrow it down and thinking about women from all diversities, especially women who use drugs, and how far they are from research and policy.
Absolutely. I think this goes back to this point and the importance of collaboration from the beginning. I think in terms of that partnership, chalking, a lot of times in research, we bring people with living experience in at very different points of the research, right? It's, oh, I have an idea. What do you think? Or, oh, we're starting this data collection. Can you tell us if this design makes sense? Or, it's sort of consultation rather than collaboration. And I think that is often the case with policy as well. And again, I think thinking about ways to close that gap as well, again, thinking not only just about the funding nature, the funding topic areas, but also the nature of the funding. Sometimes it's also really, there are administrative barriers to being able to pay and properly pay community-based organizations for the work they do in consultation, collaboration with organizations, academic organizations in particular. And so I think, again, the most effective work that I've been able to do is the most flexible funding streams. And I think that, again, is how I really do feel we will be able to bring women who use drugs, their voices to the center. Because, I don't want us to continue this path. Parina alluded to it a little bit, and I'm happy to take the mic and highlight it from an academic point of view. The payment for community partnerships, whether it's through consultation for policy or academic, it's not right. It's often much, much less. And we need to show the value, how we value women with living experience around their drug use and all these other identities in more ways than just sort of taking the ideas in some ways. That's harsh, and there's a lot of good, but I'm choosing to take a point of talking about all the negatives. I'm happy to talk about all the positives as well, but we have a lot to learn in academia.
Actually, couldn't agree with you more as well on this. And thank you, Dr. Nandita, for sharing your perspective.
Thank you.
Moving on over to our next speaker, who's Angela, who's the Global Coordinator for Women for Global Fund. Angela is a passionate feminist health advocate, researcher, and internationalist professional dedicated to advancing gender equality, public health, and human rights. She has led strategies to combat stigma, discrimination, and structural inequalities while strengthening health systems. Angela has extensive experience in international cooperation, global health policy, and pandemic management, particularly in HIV, SRHR, and infectious disease control. She has contributed to global platforms, including Global Fund's Country Coordination Mechanism and UNAIDS Program Coordinating Board, among other things. So directly, let me kind of, jump to my first question to Angela. So Angela, please share about Women for Global Fund statement related to women who use drugs, providing insights on the importance of investing in gender transformation, health, and community systems. Over to you.
Thank you. Thank you, Sylvie. And I want to take this minute of opportunity to just be extremely happy and honored to be in this space with over 70 people here in our audience today, which is very amazing from different, I also see very different regions learning from each other, which is a good collaboration and knowledge sharing, because we know that differences and diversities and the challenges that we are all facing as women in the diversity are very mutual from some regions to the others. And today we're highlighting the experiences from the Asia Pacific region, which is extremely important to create also this safe space of conversation and dialogue. So thank you very much to all of you who are here present. I'll start by sharing also a bit of who we are as Women for Global Fund. I know this might be the first time we're encountering some of our partners in the region. And let me just share a few slides. I know we have this mode of conversation, so I will not be that far, but we are a movement of women advocates, specifically, next please, specifically working in around 75 countries and aiming to expand also this reach in Southeast Asia, and the Pacific, to bring the voices of women advocates to know what are our rights, how we empower ourselves, how we really strengthen our participation in decision-making spaces. And as also Dr. Tomoko was saying in the beginning, this is a crucial year for us because we're working on the aid replenishment, and we do have a statement for women who use drugs, worldwide, but we want to hear now more from you. We want to know what are these challenges and how we can put all these key decisions and key needs in the global decision-making spaces. Next, please. And when we mean by diversity, I was appreciating also some of the comments that were on the chat indicated what gender really means, what women in other diversity really means. And we are embracing here women from all the backgrounds, living with HIV, affected by TB, affected by malaria. I think all these intersections are really important. And as we were also mentioning, sexual reproductive health and rights are very key. And we need to understand them better so we can put all these needs, harm reduction. So let's embrace our diversities. Let's put our components of gender diversities, queer, LGBTI communities, also very important to bring the voices of all of us in the regions to this meaningful participation. Next, please. And what we are doing, and in collaboration with many partners, we're trying to really ensure that the diverse people and these diverse women and girls are involved in the decision-making processes. And we are not talking about just being present or being at the table. We want to be the voices leading. We want to be the voices receiving the funding, flexible funding. I want to really be emphatic about that because this is something we are strongly advocating for. Also through the aid replenishment, knowing it's not only about having the funds, but it's where do we invest the funds and how those are returning for development and our own health and well-being. Next, please. And I know that we are talking about the reality and regarding the statement again, and to respond to the question, we're highlighting what is the reality for women who use drugs. And we have been hearing also from our experienced panelists, these component barriers are including high stigma, discrimination, and in majority of the spaces, criminalization. And I think this is very important to also talk about the gender backlash and the importance of the rising movements that are against human rights. And we're talking about regression. And in this critical moment, we need to face the circumstances and how we advocate in a hostile environment in which harm reduction services, what I'm saying, if they are available in some spaces, they have took us many years to include harm reduction services, and now we're fighting for the most basic life-saving treatment services around the globe. We know about the cuts, we know about the funding-free situations. And what we need to know is that the war on drugs and the current politics are also affecting women, with a higher proportion of women who use drugs that are being incarcerated, absolutely unfair situations for majority as compared as men. And this is a global statistic that we should be very clear. And why do we need the information? Why do we need the investment? Is because we are mostly more affected in general globally. And this reality is also that in the health sector, we are much more higher risk to have any other diseases, as for example, HIV, like knowing that women who inject drugs, for example, have 50% more likely to contract HIV than men. And we're still not in the programs, we're still not in the funding requests, we are still far away from conversations. And harm reduction programs are not all of in other countries included. And if they are, we are risking them to be excluded because of the current funding cuts. So we really need to be very bold about knowing that this intersection, harm reduction, TB, malaria, HIV, intimate partner violence, as also speakers also mentioned, gender-based violence, are limiting our abilities to access health services. And this will really come into a very critical position in which we need to put all these priorities in the table for discussion. And we have the evidence. That's the most important part. We have the evidence that all this works and the investment in our communities is worth. So it's very important for us to keep on working on this. And you can see also the presentation afterwards. Let's come after with the next one. And next slide, please. And I will just again, responding to the question about the statement. Sylvester, maybe I stop here and then you can go to the next question about, can you go back to the back slide, please? The back slide, yeah, great.
Thank you. Actually, well, frankly, I didn't want you to stop, but then, okay, fine. Let's kind of, also imbibe the second question, which is how women from all diversities can come together and push for global funds, aid replenishment, and beyond as well. Please go ahead.
Thank you. No, I would just like wanting to also frame a bit more on what the air replenishment is and why this is important for us. And just to remind ourselves, the Global Fund has supported harm reduction programs and is probably one of the biggest funders in the world for harm reduction programs. And it should be that way. I mean, we should be advocating for more direct funding for this kind of programs. And we know that it's based on the evidence. And I'm glad also that Ananditi was able to talk about this importance of joining and how to really bridge the gap between academics and international organization and community-based organization. And this is how we can do it, like putting the priorities of communities of women who use drugs at the center. And we should be integrating hepatitis C, for example, with HIV, and those are already included in the model framework of the Global Fund. So it's really important to know how to navigate the documents. It's really important to know that we should be also integrating services like housing, psychological support, employment initiatives, and we should be advocating together to have in these policy reforms what are the alternatives to incarceration or criminal sanctions, because those activities are and can be included in what we talk about harm reduction, comprehensive services, and policy advocacy and reforms. The next one, please. And why it's very important this year and why we are talking about the air replenishment, and probably you have seen this on the media, and if not, I invite you to please go and read the investment case. Investment case is a document that has been produced by the Global Fund in order to allow us to use some key data and information as we need to together as a world come in solidarity and work to pool resources from around the world to work and invest on implementing comprehensive HIV, TB, malaria. And I would say, of course, also we talk about the comprehensive needs of women around the three diseases. It's not only HIV, TB, and malaria isolated. This is the need for us to build resilient and sustainable system for health. And it's up to us as women in the diversity to put all the priorities and how these intersections can be linked. And we know that these priorities cannot be isolated. We know that if we talk about sexual and reproductive health rights, if we talk about abortion rights, if we talk about HIV, we are talking about a pregnant women that is affected by malaria, for example. How we interlink those realities and how we put all these needs in this funding request is through the advocacy that we can do. And we need to get together, and I'm showing here just a timeline, as we have very few months, let's say, to mobilize all these resources to put this advocacy in place in order to reach September and know that the result is going to be published under which commitments donor countries and implementing countries have put in order to keep for 2025 and on. Next slide. And I will be very clear about this. The air replenishment is not about the pledge. It's about us ensuring that all the funds are translated into impactful, gendered, responsive, and transformative programs for women who use drugs, specifically in this case. And we need to be very strategic about how we can do it. I will pass really fast, just one more minute, on which is our role and how we can play and influence the air replenishment is through our advocacy and accountability. We should be demanding gender transformative funding to be included in the programs at the national level, but also in the funding request, and how we do it around our country coordinating mechanism in the Global Fund in the country that are supported. We should be empowering and working through the community leadership, ensuring that our decisions are connected and funded in these processes. And we should know more about gender transformative programs. We should be pushing for policies, tackling the gender inequalities, including and knowing about sexual and reproductive health and rights, harm reduction, and most importantly, we should be knowing what is already included in our country grants. If we know this information, we're able to advocate and transform what is over there. And please contact us, contact departments, contact parliamentarian decision makers. It's very important for us to know how and who to reach in order to include here. You can see here a list of things that we are just putting as some examples and some things that can be included and tailored to the women's needs. And we have talked about HIV a lot, but we should be talking also about childcare support, safe consumption spaces. We should be talking about mental health and psychological support. All this should be also included in what the priorities for the women and girls are. And especially, we should be talking about women who use drugs needs. This is a very neglected topic. So encouraging us to reflect and put these priorities and share in the region. And finally, these are also a list of things that we have been recommending. I will just let you just go through them, and we'll share the slides afterwards. But it's very important for us to be integrating healthcare services and approaches and the intersections that we should be putting more actively on implementing, designing. And as my colleagues mentioned before, it's not only about us being subject of study, of subject of the programs. We are experts on our fields, and we know the best what are our needs for us. Next slides. And how it's part of this is using key resources, advocacy tools that we have been able to develop all around the years of expertise, and with a lot of feedback from everyone. It's here you can see many tools, resources. We have around 32 resources available for advocates to choose the topic they need to advocate for. And we also have a 10-step guide in which we can see how to navigate complex global fund processes and the CCM mechanism. We know it's a battlefield, so we need to be strategic, we need to be united, and we need to really be focused on how we're going to navigate this together. And please feel free to just go through the resources. Next slide, please, and I'll finish now. And this is an open call collaboration for everyone, because this is a space for everyone. This is a space for us to just gather ideas. And on behalf of organizers, IPPF, Columbia University, different regions, we're interested in knowing what are those needs, what are your priorities, what are your challenges. So please feel free to fill this form and let us know what are those needs, that we can come up together afterwards and see this call for collaboration and make those actions a reality. And just we're going to open in the next month the Asia Pacific Learning Hub. So this is also an invitation for everyone to be joining on the next month. We will be opening this specific space for Asia Pacific. So I thank you very much for the time, and I'm sorry I took a bit 2 more minutes, but I thank you for this opportunity. I'm very grateful for this space and having such an amazing audience and panelists here. Thank you.
Thank you, Angela, for that. It was quite an extensive information, but very, very important and very relevant as well. I can also see a lot of activity on the chats that goes to show that there is so much of side chats also kind of happening, conversations as well. And with almost 57 people, we are actually still really going strong. Now, over to our last speaker, who is Anmol Rai, who also happens to be Miss Trans Nepal 2024, and our clinic coordinator and counselor for Rainbow Clinic Family Planning Association of Nepal. Anmol is a passionate queer youth advocate and also affiliated with Blue Diamond Society, a community-based organization for LGBTQIA communities of Nepal. A warm welcome to you, Anmol. And my first question is that how can we, as a young person especially, how can we achieve SRHRJ for women in all diversities? Please share your experience of working at FPAN as well. Over to you, Anmol.
Thank you so much, Sylvie. Am I audible?
Very much and clear.
Okay, thank you so much. Thank you so much, IPPF, for giving this wonderful platform, especially targeting to the young people. And thank you so much, Sylvie, for having me, and FPAN for nominating my name to be the part of this webinar. Yes, Sylvie, there's a lot of things that we still need to achieve. However, I will speak on behalf of, on aspect of Nepal. I would say to achieve, we have to be really strong in legally and policy terms, because when we talk about gender, there are no gender diverse community included in all the genders, and we're still facing a lot of problems in that. And to achieve sexual and reproductive health rights justice, it should be really accessible and inclusive healthcare services, which should be comprehensive and non-judgmental and stigma-free. Because every time our queer specific, specifically queer people, when we look for a service, there is a very judgmental environment and where queer people are not comfortable with that. And that's how being a queer individual is really hard to get the proper services. And a lot of people, they are facing a lot of gender-based violence as well. And it should be really intersectional, and the person who is going through the problem should be the one sharing their problems, not the someone else, not the misrepresentation, which is the recent problem that we are facing right now, is misrepresentative person speaking on behalf of LGBTQI plus person, and that's why we are not getting a proper hormone replacement therapy as well. And I think if we focus on these terms, specifically these all the problems, that's how we can achieve, sexual and reproductive health justice for all the women and diversities. And talking about my experiences working in FPAN, till this date, it has been really, really amazing. I am working in a Rainbow Clinic. Rainbow Clinic, for anyone who doesn't know, is Rainbow Clinic is specially designed to provide a safe and inclusive space for queer individuals and transgender peoples. There is a fun story that I started. I visited FPAN as a clinic at first. Sorry, as a client at first. And I was like, there was like my fellow sister who was working there, and I was like, oh my God, this is so cool. But fortunately, I mean, unfortunately, but fortunately, my lovely sister, she had to leave, and I got a chance to be the part of it. And, I was always really passionate about working for the queer people, but FPAN giving the space for the transgender people really, really helped me to evolve and learn so many things. And at the same time, I can also do something for my community. And FPAN really gives beautiful services for the queer people. We give hair removal, hair laser removal, hormone replacement therapy services, hydrofacial, and microneedling in a very affordable range. Why? Because a lot of queer individuals are suffering financially, they're struggling a lot, and that's why we expect this kind of stuff from the government. But FPAN is leading a great example. They are playing a biggest role to help queer people like me and like all my friends in Nepal right now. These are the services that we give, and till this date, every client that have visited in our clinic have given the best review. And also we are also growing and learning as all the NGO member. And overall, it has been really great, and we're also like working on it to make it even more better in upcoming days.
Thank you. And this actually leads me to the second question, which is, what according to you what should service providers and policymakers do to decrease the barriers to access and increase availability of SRH services?
Sylvie, to decrease barriers and to access and increase the availability of sexual and reproductive health rights, services for diverse women, especially for the transgender women, I think service providers and policymakers must take inclusive and intersectional and right-based approaches, such as, there should be stigma-free, like I mentioned before, and inclusive services must be really important and mentioned. Because when we talk about sexual and reproductive health rights in Nepali context, it is just limited for the cisgender people, because it is not accessible for the transgender people all over Nepal. And especially when we talk about sexual and reproductive health rights, there's always missing the trans men, how they are facing a lot of things with a gynecologist, or also, having going through all the menstruation and stuff. We are missing all that right now, and that's how we are preaching about it, because it should be accessible for everyone, not only cisgender people, and should not be limited for the certain type of people, right? And it should be we should always like prioritize no matter what background you are coming from, no matter what caste, what gender, what identity you are coming from, confidentiality is most important, because there are a lot of queer people, not getting accepted by the family. However, Kathmandu is the only place that is liberal compared to the other city beside the Kathmandu. And people come here, people visit here, a lot of people from the out of valley come here just to get the freedom and to live their life. And our personal stuffs are not respected. That's why confidentiality is really, really important. And we should also respect other people's boundaries. So, and while creating this space and making a policy by the leaders, there should always be a queer person in also with the panel or making that decision. Because, for example, I can hold a sanitary pad and, preach or like advocate about the women or like for the people who go through all the menstruation, right? But I don't know the problem, how they've been through, because I don't menstruate. But this is the problem that we are facing right now in Nepal, that there's always a wrong spokesperson for us. And I think it would be so much better for our community member going in that position and speaking for ourselves, who have been through all the problems and can speak for ourselves, and we can also relate with the person. And if we focus on all this and work together, we can achieve a really, really amazing thing that can make safe space for all the queer individuals. And also, there is a lot of trans women who is using drugs, and there is no any trans friendly or queer friendly rehab in our Nepal. Just before, Parina Didi's sister, she mentioned very beautifully, and then my eyes were opened. And our community also have been facing a similar kind of problem for the people who are living with drugs right now. And that is why there should be a customized services for the trans people who are using drugs. And there should be a proper intention to look towards the group of people who use the drugs. Not only, we are always taught that, oh, people who use drugs, they're a bad person, they don't lead the good example in our society. I completely disagree with that. That is why if we focus all these things and work together, then we can make a better safe space all over the world, not only just Nepal. Thank you so much, Sylvie.
That was quite strong. Thank you, Anmol, for this, I would say, lived insights, especially working with the communities. I know that comes from the heart. Thank you so much. Now, actually, we can also actually, look at some, we can actually go to some question answers as well. And before that, if we can actually, we can do a group photo, and then we can jump into the question answer session. It would be great, so we can capture the moment. I would request everyone to please on their cameras so that we can have a nice group photograph of all of us. I hope the communication teams from is active and doing whatever is to be done. Sorry. Let us know once we are done so that we can kind of continue.
Smile. Perfect.
Thank you, Angela. Yes, I think we do have a few. I think we had a couple of hands up somewhere. I think there was an iPhone.
So Ruth is also trying to raise her hand,
Oh,
but
yeah.
Ruth, you can open the floor.
Thanks. Thank you very much, and thank you so much for organising this event, IPPF, and also Women for Global Fund. I shall try to keep it brief. There were so many issues that came up, but I feel really compelled to speak to a few. Obviously, I'm not an Asian person, but I've long been involved in harm reduction and working with women who use drugs in the region. I actually filled a role for a while with the Asian network of people who use drugs simply to fill the gender gap in a technical capacity, serving on their board for a time. And I have been feeling these issues for a long time. Thank you so much to the speaker from Women for Global Fund for actually using the term harm reduction. Having worked in this business for 30 years, I remember when harm reduction was introduced to the region, and I think there was a terrible mistake. There was a huge attempt to not be neo-colonialistic and to work with what was there, which was basically Narcotics Anonymous. And I remember there was this sort of pyramid about, safest if you don't use, next safest is if you don't share injecting equipment and so on. That should have been the entry point that lasted for 5 minutes, but unfortunately it has lasted until today, and it kills people. It means that the few services that are funded to do harm reduction sort of dangle a needle, but say, please don't, or use less. If that was me, I wouldn't be showing my face there ever again. This is an ongoing problem that needs to be tackled head on. And so interesting that everyone wasn't talking about harm reduction as the only sensible vehicle for really elevating the voice of women who use drugs with agency. So I really needed to say that. Secondly, about research, for heaven's sake, for more than 10 years, 20 years, there have been manifestos released by organizations of people and women who use drugs about the imperative of not just using people who use drugs as subjects in research, but having people who use drugs run their own research. There's plenty of living examples of this, and there is no excuse for having a debate about it anymore. Not just participatory research. If necessary, you train people who use drugs to do their own research. Okay, so sorry, but I do feel really strongly about that. Do look up online the 101 manifesto. It tells you like step A through to Z on exactly how to do that in case you are struggling. I think also we need to understand the full impact of what is happening around the world right now. It's a little bit like the beginning of COVID, a very sudden assault on both harm reduction and gender. As somebody that works in that overlap area, I'm monitoring very closely, as we are through our allies around the world, that Input has done independent research where the hardest hit, among the hardest hit, the first to go down. It's not a time where we can expect luxuries of streams of funds from anywhere. But I think now that I've had time to digest it, it's kind of like a huge shock. But we need to be looking for a phoenix rising from the ashes, and that has to be about collective action. It has to be about uniting affected movements, about uniting, the intersecting oppressions. Someone said earlier, in a utopian world, there wouldn't be a gender identity. Exactly right. Nobody's having sex 24/7. Nobody is injecting drugs or using drugs 24/7. We have these identities because we are oppressed, and we have no space now, and we never did, for putting aside sex workers or women who use drugs as the bad ones. That was never true. We're actually the champions to be fighting against this patriarchal push from maniacs around the world. We're facing a rising conservatism. Thank you so much for the Women from Global Fund speaker. I think, when we look at the Global Fund in particular, let's also ask the Global Fund, please as I have been asking them for many years, give us a breakdown on how much of your harm reduction funding is gender focused. They say, oh, we'll have to do a deep dive, but yeah, I mean, like obviously our advocacy should be going to support the Global Fund as the only apparent, potentially not touched by crazy politicians and not sensible governments, but also working with governments that are able to pick up the slack. But let's not lose sight of the common enemy and the potential for solidarity among us here. Thank you.
Thank you, Ruth. Thank you so much. I would say we needed that as well. The face on reality, I would say. Um, do we have any other hands for questions or queries or any messages? I don't see any right now. Thank you. I can't see anyone here. Okay, so actually now that actually leads us to, well, I would now finally request Alia Amimi from Women for Global Fund for the closing remark. Over to Alia.
Thank you so much, Sylvester. And thank you all for being here today and sharing with us, this critical discussion. I think we've had a really incredible insights, conversations from the speakers about the realities of women who use drugs in the Asia Pacific regions and who, remain largely left behind in the discussions, the policies, fundings, and programming. So today's, the conversation reminds me that gender transformative programming is not just an option, so it is a necessity. If we want to make sure to achieve the real and lasting impact. So I will sum up some of the key takeaways from today's session. First, it's about the urgency of the moment. Because women in their diversity still face systemic barriers in accessing health and harm reduction services. So we really must center their experience and leadership in decision-making processes. And we really challenge the harmful norms and structures that are still perpetuating inequalities in health services, but also health outcomes. And like all of us, said today, evidence is power, information is power, and there is a real necessity to focus on research and data to strengthen gender transformative research that can allow us to advocate for more effectively and hold decision making and decision makers accountable. We also need to work together. Advocacy is only stronger when we are working together, and partnerships between civil society, community networks, academia, policymakers, and grassroots movements needs to be fostered to make sure that we have this to drive this real change. Also, like we said, women who use drugs are left behind. The stigma they still face today is remains deeply rooted and persistent over time. And we can see their absence from data, from funding priorities, also from decision-making spaces, and it results in their needs being overlooked. So without having really disaggregated data, we cannot fully understand the scale of their needs, and we cannot design effective interventions. Specifically, for the next Global Fund programs, we need to make sure that the interventions are aligned with their needs and their priorities. That's why I think that the current funding models that do not reflect the realities of women who use drugs, and the few investments that still exist only focus on HIV, and they don't take the holistic approach. So we need to advocate for a flexible funding. We need to advocate for more technical support, and we want women-led groups to sustain their work over time. And finally, I think the important point is that we need to give women who use drugs platforms to advocate for their rights, for their needs and priorities, because there are limited spaces for their voice to be heard. And this leads to a cycle where their issues remain underfunded, overlooked. So we need to push for more platforms, for more visibility, and more engagement with, women-led movements and movements of women who use drugs. So as next steps, I would remind again that Women for Global Fund will launch its Asia Pacific Learning Hub by the beginning of April. So I invite you all to participate, because this platform will be a safe space to discuss advocacy strategies, to support women advocates that are working on the ground, and also to provide knowledge sharing, networking, and also collective strategizing to really make sure that we are strengthening our advocacy for women in their diversity. Also, I think on behalf of IPPF and Women for Global Fund, we invite you all to engage beyond this webinar. It's just the first step. So we will share with you, QR codes and invitation for open collaborations. And we want to make sure that people who want to contribute, to learn, and also to exchange ideas, best practices, and experience have a direct pathway to do so. And I think the most important thing for me is that we need to turn this discussion into action. I think we will share with you a report with the key takeaways, the action items that we have discussed today to guide the follow-up. And we need to continue track the progress. We need to mobilize resources. We need to all meaningfully engage in the preparation of the aid replenishment, because it means allocating more fundings, more investments for women who use drugs programming, and for women in all their diversity, and to really shape the policy discussion and funding discussions. And finally, I think we need to advocate for flexible funding. For me, it is crucial to have flexible funding to make sure that at a grassroots level, we have access to technical support, we have access to long-term investments and unrestricted funding. So this short restricted funding is not helping at all. And the aid replenishment, I think, is a great opportunity to push country donors and policymakers, including parliamentarians, to see women not only through an HIV lens, but through a holistic human rights framework that includes SRHR, poverty, economic justice, gender justice, and harm reduction for all. Thank you so much.
Thank you. Thank you, Alia. Yeah, I think we are almost at the end of of this webinar. I would actually, before closing, I would like to thank all the speakers, Women for Global Fund, all community-based organizations, and the representatives from across, all the partners, participants, and and the audience who have been here. Thank you so much. Once again, thank you so much from IPPF family, and Women from Global Fund. Thank you. Thank you so
Hello,
much.
I'm sorry, just before we
Yeah,
close,
please.
I'm sorry. I just wanted to send a link. Well, I know that it's not the 67 participants that are here anymore, but this is a Google Forms
50
that
of
is
them.
very important for
Okay.
us for attendance. And we'd like to thank everyone for joining the meeting. But yes, this Google Forms, if you have, it'll take you just 1 minute, and for us, it's very valuable for you to be able to fill out this docs for the attendance. And thank you very much for everyone who was here, who stayed through the whole speakers, and thank you for your knowledge and input.
Thank you, everyone.
Thank you.
Thank you.
Thank you,
Thank you,
Sylvie, for
everyone.
wonderful
Thank
facilitation and
you.
all the speakers. Thank you, all the speakers. Bye-bye.
Thank
Thank
you.
you.
Thank
Thank
you
you,
so
Dr. Praveen.
Bye.
much.
Thank you,
Bye-bye.
all the
Bye.
Thank you
speakers.
so
Bye.
much. Bye-bye.
Bye.
Bye-bye.
Okay, bye. Let's close it.
Bye. Thank you, everyone. Amazing webinar. Thank you.
Thank you.